Hey guys, what's up, friends? Welcome back to KimmyDTV, a place where nurses, aspiring nurses, and healthcare providers, basically a place where healthcare providers come to achieve academic, career, and life success. Welcome to another study session with me, your host, KimmyDTV. And today we're going to be going over the musculoskeletal system. I said I would be back today at 2 p.m. as promised, and here I am. I'm going to wait for some people to get in here. Yes. So, who am I? Why should you be a part of this live stream, this study session? Well, my name is Kimmy D, and I have been an LPN for about 7 years. And thank you, Miss Shia Jones. Hi, Miss Shia Jones. That's so sweet. So you make an excellent teacher. Thank you. So yeah, I've been at LPN for about 7 years. This October 2020, and I have been an RN. All at the end of May, I will be an RN for about 6 months. And guys, I can't stress enough. I can't wait for that year to go by in terms of being an RN, because it's like everywhere you go, they want experience. And I'm like, well, I've been an LPN for 7 years. And they're like, I don't care what experience you have, what experience you have. So that is kind of annoying. I'm not going to lie, because I feel like, you know, hi, Just Brandy. Hey, thank you for joining. So yeah, it is kind of annoying sometimes, because even though I do have all this experience as an LPN, a lot of employers, unfortunately, I don't know if it's the state I'm in Texas right now. A lot of the employers are like, well, LPN experience is not RN experience, but some employers are a bit more lenient, but unfortunately, they don't count LPN experience as RN experience. So that's the only downside I'm going through. So I'm just trying to navigate that. But you guys are going to see a day in the life of a Texas RN video coming out soon, okay? So I hope you guys all had an amazing, great, excellent day. I did. I got my hair done. I got it flat ironed. And yeah, guys, I hope you guys had an excellent day. I'm trying to like stall a little bit, let some people come in. But yeah, I've been doing a lot of self-work, a lot of self-love work, and just a lot of goal planning on, you know, where my life is now and where I want it to be, and that's internally and externally. So I do encourage you guys all to do the same, always plan not just external goals, but internal goals. Like maybe you want to stop procrastinating. Maybe you want to love yourself better. Maybe you want better relationships. Maybe you want whatever it may be. It all starts with you and loving yourself and knowing that you are worth it. Okay. So, all right, guys. So I think I'm going to get started. If you guys are ready, put ready in the chat. Okay, now we got 4 people. If you guys are coming in, please hit the like button. Hit the like button as you guys come in. I'm trying to wait a little bit, but yeah, we are gonna start pretty soon. You guys like my new watch? I like how the Apple Watch looks, but I don't want to spend that much right now, so I got this at Walmart. And I think it's pretty cute. All right, guys, so I'm going to start without further ado. I'm going to start with our review. Okay, so today we're going to be reviewing the musculoskeletal system. Hey, KOD29, good day, good day. Thank you guys so much for coming. Good day, good day, good day. I got my little water here. It says I love summer. Oh my God, every time I'm around these lights, because I actually have lights in front of me. They're like small lights on my vanity, but it makes me so hot. I gotta turn on the fan because it's so hot. Woo! This light making me hot. So I have my water. Isn't this so cute? All right, guys. So without further ado, I'm going to start. Are you guys ready? Are y'all ready to work through these questions of the musculoskeletal system? Type ready if you're ready. No music, but we dancing. Okay, good. Just Brandy says ready. Kayla D29 says ready. Okay, let's get to it. All right, so let me start sharing my screen. Share screen. That one, this one. PowerPoint. Save. Okay. Just bear with me one moment. I have my PowerPoint slide here. Just trying to share it. Share screen. Share screen. Window. That's strange. Bruh. Alright, I'm gonna have to see if you guys can see it here. Let me go. On my channel to see what you guys see. I used to be able to share that. Okay. Let's see if that's what it shows. All right, guys, I think you guys see it. All right. Okay, this is going to be our musculoskeletal review. KimmyDTV. Don't forget to follow me on Instagram. I've been posting a lot more. And let's go. Remember, there's no such thing as a stupid question. So if you have a question, go ahead. Okay, just Brandon says we see it. Okay, good. All right, so this is the first question. It says, you are the nurse working on the med-surg unit. Your patient has an open fracture of the left tibia and soft tissue damage. Your patient underwent a surgical reduction and fixation of the tibia with debridement of non-viable tissue and drain placement. Okay, it says, which assessment finding should concern you the most during the post-operative period? Okay, is it A, complaints of pain when moving the affected limb? B, muscle spasms around the affected bone? C, light yellow drainage from the wound? Or D, fever with chills and night sweats? So what do you guys think it is? I'm going to let you guys work through it, think through it, and put your answers down below. But automatically, when I look at this question, the first thing I do, because there's a lot going on, there's a lot of different words going on, I try to like make a picture in my mind. So this is why I give you guys these pictures here. Open fracture. This is a picture of an open fracture right here. I'm not going to give you guys too much because I don't want to give away the answer, obviously. But here on the right, on my right side of the answers, you see an open fracture, and right below it, you see like a picture of a soft tissue damage. So it's important to like, when you're looking at those questions, to get like a visual representation in your mind so that that will help you answer the question. So the patient has an open fracture of the left tibia and soft tissue damage. So the patient underwent a surgical reduction and fixation of the tibia with debridement of non-viable tissue. So that they're removing all the dead tissue that, is not viable. That meaning viable means like it's just dead. It's not working. It has no use of the body. So anything that has no use, you have to remove it. And drain placement. So they probably put like some kind of a drain facilitator to just remove like the pus and everything else. The pus, the secretions, everything else that may be in that leg, of course, because it's an open fracture. And it says, what assessment findings should concern you the most during the post-operative period? So right away as a nurse, I'm thinking, okay, when they said the most, it's like, what is alerting you right now? Like, what in these answers are alerting you, saying danger, danger, danger post-operatively? Okay. Just Brandy all day said D. Okay, I'm gonna let some other people give some answers. But when you look at this question, you're gonna want to think like, what will give you an alert after they have had that? I'm gonna give you guys a few more seconds. I should have like a timer. I should really have a timer. I see some people coming in. Please hit the like button. Please hit subscribe, hit the notification bell so that you never miss a video from me on this channel. I host live study sessions, live videos based on different topics as it pertains to nursing and the healthcare system in general. And I also post day in the life videos, all kinds of videos. So I'm sure you guys will truly, truly, truly find something on my channel that you can get value of. Okay, so K Doe 29 says D. Okay, everybody's saying D. Y'all doing good. Y'all doing good. Shahar says D. Hey, Shahar. Nice to see you back again. Shahar says D. Fever with chills and night sweats. All right. So we got 3 Ds so far. We've got 3 Ds. Can I get a 4D, 5D, and the answer is, I'm just kidding. Okay, so everybody says fever. Most people say fever with chills and night sweats. So let's see the answer. You guys got it right! Woohoo! The answer is fever with chills and night sweats. Okay, so I know you guys are automatically probably thinking this patient may have a infection. Okay, because if they have fever and chills and night sweats, they have an Hey, Teacher Jen. Yes, it is D. Yay. So yeah, so you guys got it right. It is fever with chills and night sweats. Okay, so let's see what it is. So the first thing I want to break down for people who don't know what it is, because I truly believe in like when you have a question, being able to know what every part of the question means. If there is a sentence or a word that you don't understand when you see a question, when you're studying for nursing school, you're studying for NCLEX, please, 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 for the love of God, even if you don't remember it, look it up, because you don't want to just like, okay, boom, here's my answer and that's it. You want to be able to know what it is. If you don't know what an open fracture of the left tibia, like what the heck is that? You have to like quickly, like this is what I would do when I would study, guys. I would quickly Google it, okay? Or I would take my med-surg textbook. Well, no, I didn't really use my big med-surg textbook that much. I would use like my Saunders book and I would quickly look it up and just like not really go in, but skim through like the nursing interventions and just get a deeper understanding, just because I want to know what it is. Or just use Google. Teacher Jen said, Nurse Jen now, LOL, after the NCLEX RN. Oh, congratulations, Nurse Jen. Congratulations. Let's congratulate Nurse Jen after passing her NCLEX RN. Hey, NCLEX RN. Yeah, listen, guys. The NCLEX RN, I really want to help you guys pass that and nursing school. The course I'm working on right now is mainly based off of nursing school, but I want to show you guys how easy it can be, how like it's just hyped up in a certain way when it really is. I'm not saying it's an easy peasy test, like you don't have to study, but it's just really about learning how to think like it. It's I don't want you guys to think like, oh my God, I don't want y'all to think like that at all, okay? Yes, congratulations. All right. So fever with chills and night sweats, okay? So I want you guys to like think, because in my opinion, like even when I was reading this book, like I recently passed an NCLEX in November with only 75 questions, and I don't know, maybe I spent 30 minutes in there, maybe less. And I even forgot, like, what is an open fracture? I'm being completely honest. I had to Google and find out and remind myself what is an open fracture. So an open fracture, also called a compound fracture, is simply put a break of the bone through the skin. That's it. You see the picture right here? So now that you see the picture, you will always remember it. Don't try to complicate it. Don't try to make it into equation. Just remember, open fracture, also called a compound fracture, is simply put a break of the bone through the skin. That's it. That's all it is. Don't try to complicate it. Don't try to make it anything. Because like for me, I don't know if any of you guys do, but when I was learning about musculoskeletal, I was like, what is compound? That sounds so hard. What is open fracture? But it's not a complicated thing. Open fracture, compound fracture is simply put a break of bone through the skin. That's it. So this is for my people who like to complicate things. I being one of them sometimes. I can admit that. That's all that it is. And the picture that you see to the left of it is a closed fracture. As you can see, there's still a fracture, but it's closed. And I have a perfect example. Like I know there's this lady in my nursing home job that I work at, and she had a fracture and she didn't even know she had a fracture. It's so weird. She said she was walking downstairs a certain way and she felt a little pain, but she just ignored it. Now, how is she able to do that? I don't know. But she went to the doctor just to get everything checked out because it was starting to hurt her after a couple of days, and they found out she did indeed have a fracture. So it's very important to know and keep in your mind that it is indeed possible for you to have a fracture and not even know it, because it could be closed. But of course, if it's open, you'll know, hey, it's open fracture. So we already know what open fracture is. Okay, so we already know what open fracture is, and this is it, right? So, okay. So, why is it fever with chills and night sweats? Well, the reason why it can be fever with chills and night sweats is because can anyone put in the comments? Oh, Teacher Jen says she hasn't taken her NCLEX yet, but thank you. I love your videos. Teacher Jen, guess what? We did this with Melanin Mama too in my live a couple months ago. We already claim it. You already RN. Okay, we already claim it. Okay. Jen, RN. We already claiming it. Okay. That's okay. I see more people coming in. Please like the video. Please hit subscribe. Hit the notification bell so I never miss a video. But like the video. It really helps my channel. Okay. So I wanted to bring home a factor. I want to bring home a point. Is why would the most important assessment finding be fever with chills and night sweats? Why do you guys think it's not muscle spasms around the affected bone? Why do you guys think it's not muscle spasms? Because that is an expected finding. There can be muscle spasms around the affected bone because there is, obviously the first line of defense, which is the skin, is broken into. So a muscle spasm is possible. Complaints of pain when moving the affected limb. Would that seriously be the most concerning thing after surgery? We expect the patient to have pain. So we're not going to be like, oh my God, this patient got pain. This patient just got surgery. Of course this patient's gonna have pain. Light yellow drainage from the wound. We expect that, okay? The patient had an open fracture through the skin, okay? As you can see in the picture. Fever with chills and night sweats. Yes. Teacher Jen is so right. She said open wound can lead to an infection. Thank you, thank you, thank you. Let me put your comments on the screen. You guys are on the money. Okay? You guys are seeing my Yes, Shahar says signs and symptoms of possible infection. Hey, Dana. Dana says, hello, beautiful people. Hey, 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 hey. Yes, but signs and symptoms of possible infection. I'm sorry, guys. I'm just, all right. So signs and symptoms of possible infection. Yes, that is very true. So when you have an open fracture, you want to think if it's broken to the skin, it has already broken through the first line of defense. Imagine, look at that leg, guys. Imagine, and if you guys have taken microbiology, or if you're going to take microbiology, you're going to learn about all those small, tiny, tiny little microorganisms. That's why they're telling us to wash our hands 1,000,000 times a day as a nurse, and now as a public, especially with what's going on. I can't say the name. Because look at that leg. Look, think about how many microorganisms can enter. Think about why do surgeons scrub all the way up to their arms and everything? Because there are so many microorganisms. So yes, having an infection is the biggest threat when it comes to an open fracture of the bone. Because something that you may not have known, because I didn't know, and when I found that out in A&P, I was surprised. Hey, don't judge me, because there's no such thing as a stupid question or a stupid thought. Is if you don't know, you don't know. My teachers told me that bone is very vascular. Vascular meaning it's very bloody. There's a lot of vessels in there. And I had no idea. I was like, wait, bone? I'm thinking bone is like hard. No way it has blood in it. Yeah, it has blood in it, okay? And I know your grandma like, Kimberly, what? How you didn't know bone was vascular? But no, I did not know that bone was vascular. And I learned that in A&P 1 and 2 or whatever, which any of those those semesters, I forgot. But yes, bone is very vascular. And guess what? If there's an infection in that wound, that infection can actually travel in the blood and also cause septicemia, okay? So that's why if we see fever with chills and night sweats, we are afraid, because that can be an infection. That can really, really, really cause a major infection, a life-threatening infection. Because remember, bone is very vascular. And remember, what supplies our body with oxygen, what helps our body live, it's blood, okay? So we don't want an infection in there, okay? So to be more specific, I put that is a threat to osteomyelitis, okay? So that's the correct rationale, okay? So I said, why is osteomyelitis? Oh, and this picture, by the way, is a picture of like how they debride the bone. But why is osteomyelitis a threat? And it says, well, bacteria can easily enter from the initial trauma of the open fracture and the debridement process too, okay? So the patient, it said in the question that the patient had open fracture to begin with, and they had a fixed. If I go back to the question, they had a fixed reduction. They put it back together, and then they debrided. They removed all the dead tissue, all of that, guys. Imagine someone removing dead tissue. All of that is a major, major, major threat to having an infection, okay? So the reason why I'm hammering in on this point, because I want you guys to get it. Whenever you see something like open fracture of the left tissue, surgical debridement of non-viable tissue, you want to make sure that your patient, like the question, what they really want to know is to make sure you know that an infection is a major, major threat, okay? So we're going to go on to the next question. Don't forget to hit the like button as you guys come in, all right? So the next question is, Nurse Jamie is taking care of a patient in the med-surg unit. Her patient is to begin regional antibiotic perfusion for acute osteomyelitis of the right femur, okay? Which nursing intervention could Nurse Jamie include in her plan of care? Is it A, frequent weight-bearing exercise? Is it B, immobilization of the right leg? C, avoid administration of NSAIDs? Or D, support right leg in a flexed position, okay? So you guys might ask, Kimberly, why did you put a picture of a horse's foot here? And the reason why I put a picture is I had to like even research like, oh, regional antibiotic. Okay, so basically when they say regional antibiotic, it is focused on one area of the body. So instead of a broad antibiotic where somebody just takes an antibiotic, like let's say one time I had an infection in my finger, like a small infection from like, I think I got my nails done somewhere, and I had to take, I think ceftriaxone or something. It's like a pill. I had to take it. And that's not really a regional antibiotic. It's just like it has to go through the digestive system and break down and stuff like that. But a regional antibiotic would be focusing on one part of the body. And as you guys see here with the antibiotic entering the horse's leg, that is what a regional antibiotic is, okay? And for acute osteomyelitis, what is that? We already went through what osteomyelitis is in the previous slide. If you guys weren't there, osteomyelitis is basically an infection of the bone, okay? What does acute mean? So acute meaning it's recent, it's new, versus chronic. If you see chronic osteomyelitis, chronic means this is an ongoing process. Chronic means it's an ongoing process. It has been going on for maybe several months or years or whatever. But acute meaning it's fresh, it's new, okay? So what would be the plan of care? Okay, so Dana says B. I see people coming in. Please like the video, subscribe, hit the notification bell. Dana says B. I'm going to wait for more people to give their answers. Ooh, it's hot with these lights. Okay, think about it. Osteomyelitis. The patient has infection of the bone. Okay. Even if you guys guess, make a guess. Shahar's question mark. Even if you guys guess, just make a guess. What else would you do for the patient? What else would you plan for this patient? This patient is having regional antibiotic in their right femur. Okay, that means it's concentrated. The antibiotic is concentrated on that femur there. Okay. Okay, I'm gonna give 10 more seconds. 10 more seconds. Hey, Denise Paul. Denise Paul put A, frequent weight bearing exercise. Shahar put B, immobilization of the right leg. Okay. Mashia put D, support the right leg in a flex position. Oh, we got all kinds of answers. This is a tricky one, huh? Teacher Jen says D or B. Okay. So I would guess, like, when I first saw this question, I would guess either D or B too. All right, so let's see the answer, guys. Let's see the answer. The answer is, wow, there's a whole bunch of different answers. B. The answer is B. Yes, Portia Caldwell. Oh, that's a nice picture. The answer is B. Yes, immobilization of the right leg. Okay, so we're gonna go over acute osteomyelitis again. All right. So this is another picture of osteomyelitis, right? If you see that patient on his or her left leg, you see that picture of the osteomyelitis. And I'm asking you guys a question. Doesn't this look painful? Right? Does osteomyelitis look painful to you guys? Like if you guys see that picture, look at that picture of osteomyelitis. Like, doesn't this look painful? Right? Doesn't this look like it can break? Like, God forbid, like, imagine if there was an opening in your leg like that. Don't you think that would be painful? Don't you think that your leg will be more susceptible to break? Yikes! Don't move it, please. Don't move it, please. That's what I put. Don't move it, please. Okay. So, what I put is what you have to do is immobilize the infected leg to decrease pain and reduce the risk of pathological fractures. Okay. So, you're not going to want to do frequent weight bearing exercise, and you're not going to want you are going to want to immobilize the right leg, because look at that leg, guys. Like, that leg is infected, is open. If there was an open area of your body, guys, you would not be trying to walk around, because it would obviously be painful. Okay. And it looks like it could break at any moment, because the skin is exposed. All the protection that the skin and all that is gone. Okay. So I put, if you're not supposed to move it, if you're supposed to immobilize that leg, weight bearing exercise does count as moving it. So you're not going to want to put no weight bearing exercise at all, because osteomyelitis is an infection of the bone. An infection is basically when bacteria and all kinds of pathogens are infecting a portion of the body. And what happens when a portion of the body is infected? The body can't move the way it is. It is compromised. It is sensitive. So you're not going to want to put weight-bearing exercises. It's not time to exercise. NSAIDs, it says avoid administration of NSAIDs. You're not going to want to avoid it. Why? Why avoid NSAIDs? Non-steroidal anti-inflammatory. No, you wouldn't want to avoid NSAIDs. NSAIDs, yes, it can be used to treat the pain, and it can be used to like reduce that inflammation there. Okay. Yeah, Dana says looking at it is just painful. Yes. Denise Paul. Wow. Okay, you're welcome, Portia Caldwell. So, yes, flexion of the affected limb is moving it. Okay, so when it says support right leg in a flex position, you're not going to want to do that. That is considered moving it too. Like, you're not going to want to flex it like that. You're just going to want to, and it can cause contractures. Okay, so contractures are basically when the portion of the body is shortened in that position permanently. Okay. Okay, Dana says, how long do we wait until we can mobilize it when the infection subsides? Because nothing should be immobilized for too long, right? Yeah, nothing should be immobilized for too long. But remember that this patient is receiving regional antibiotic, meaning like it's focused on that area, and it's acute osteomyelitis, right? So it's not something chronic long over time. It's for a short period of time. So in general, you're going to want to keep it immobilized and like straight, and however the doctor, until the doctor gives you like a prescription, like saying, okay, now you could move it. Okay. So 9 times out of 10, it would be like after that period, that infection period, after you see all the pus go out, and after, like, for example, some antibiotics are for 14 days or 5 days or whatever days, you would immobilize it. So immobilize it don't mean like you can't move it like at all. Like, of course, if the patient is transferring from one place to the other, the leg has to be moved in some kind of way. But the whole point of it is that you don't want to move it. You just want to immobilize it, because that bone, that leg is very susceptible to breaking, because it is fragile. You can eat that, those bones can easily fall apart and break. It's almost like somebody has osteoporosis or arthritis. because the bone is no longer strong. You know, like what makes up bones? Like calcium, minerals. That's what keeps it strong. But if something is attacking something, you don't want to move it and play around. You want to keep it mobilized. Immobilized. It's almost like, how can I say this? It's almost like if somebody was playing football and they broke their leg. They're not going to start doing weight bearing exercises and stuff like that right away. They are going to immobilize that leg. They're going to put a cast on it so that it doesn't move, so that it has time to heal. So it's kind of like the same concept, okay? And you're not going to want to put flexion of the affected limb because it's going to cause. I hope that helps you, Dana. I hope that answers your question. And yeah, so you're not going to want to do flexion of the affected limb because this can cause contractures, which shorten it in that position permanently. So you don't want to do that, okay? So I hope you guys get that question. So yeah, you guys know what contractures are, right? It's like when the parts of the body move inwards and it stays in that position. Oh, thank you, Dania. Thank you. Yes, I welcome all questions. Please ask all questions that you have because I want to be very thorough so you guys can understand everything, okay? Thank you, Dana. All right, so the next question is, your patient is being discharged for acute osteomyelitis after being on IV antibiotic therapy for 2 weeks, okay? As the nurse, which of the following would you include in discharge planning, okay? The importance of daily aerobic exercise to maintain muscle strength. B, how to safely apply warm packs to the leg to reduce pain. C, how to monitor and care for the long-term IV catheter site. Or D, the reason behind taking oral antibiotics for 7 to 10 days after discharge. What do you guys think? I'm going to let you guys think through it. And this is just another picture of osteomyelitis to just have that image in your head. So the patient had acute osteomyelitis, and after being on IV therapy for 2 weeks, so how would the patient be discharged? Who knows the answer? Okay. Teacher Jen put B, how to safely apply warm packs. Okay. All right, I'm going to give about 10 more seconds. Dana says D or B. Okay, 10 more seconds. Okay. Shahar said, is their treatment finished or will they be receiving IV treatment at an infusion center? Okay, Shahar is on the money. She's on she's on the right track here. The answer is C, guys. Shahar was on the right track. It was how to monitor and care for the long-term IV catheter site. So let's see why this is the correct answer. Okay. So the patient is usually on IV antibiotic for several months, okay? So osteomyelitis takes several months to actually fully heal. Because remember, I told you osteomyelitis is infection of the bone, and bone is very vascular. And what does vascular mean? It means it's very bloody. So don't you think, and then remember, blood runs through our whole body. So don't you think we want to make sure that this infection is eradicated completely? And in fact, if you guys didn't know, and I've taken care of some patients with osteomyelitis, there's some osteomyelitis that's chronic, that's just ongoing. And it's super, super hard to treat because osteomyelitis is extremely vascular. So what will the patient need? The patient will need to be educated on watching for the signs of infection at the IV site. So yes, the patient will be going home. The patient is usually going home for IV antibiotics. Okay, so they want to be taught how to care for the catheters during daily activities such as bathing, like trying not to get the IV site wet, and avoid exercise and heat application. Okay, because this can actually increase swelling and risk spreading the infection. Okay, so I remember when Dana asked the question like, oh, why wouldn't you like you have to immobilize and this and that? Because remember, why would you think osteomyelitis be spread? It's in the bone, right? Remember what we said? Bone is a very vascular, even though it may not sound like it. Bone, you think something hard. Bone is very vascular. It has a lot of blood vessels. Anytime somebody has surgery, when it comes to the bone, it's very, very serious because anything can happen. A fat tissue can be dislodged, cause of fat embolism, which is life-threatening. A blood clot can happen. Anytime you're cutting into the bone and you're maneuvering that is serious. And infection is a major risk factor when it comes to anything with the bone. So especially when you have an infection of the bone, it is a really serious thing. Okay, so I want you guys to always remember heat, because there could be other questions like that. Heat makes something bigger. Okay, it could actually increase swelling, and ice can decrease swelling. That's why when they say like I sprained my ankle last summer, and the doctor told me do rice, right? Rest, ice, compression, elevation. Because what does ice do? Ice decreases the swelling, which will decrease the pain, okay? So avoid exercise and heat application, because heat will actually increase the swelling and risk spreading that infection, okay? So let me see your question. Shahar said, is their treatment finished or will they? Oh, yes. So, yeah. So that's your question. That's your answer, Shahar. Usually they will be on IV antibiotics for several months. And, teacher just have that said, well, yes. So Dana says, true, right? Even bone cancer is very dangerous. Yes. Bone cancer, osteosarcoma is very serious. Because of that reason, I believe it's because it's very vascular, and yeah, that is serious. Okay, so that's why we wouldn't safely apply warm packs, because warm packs will just make the swelling worse. Okay, imagine putting a warm pack on that picture. It will just make the swelling worse, and it could have the possibility of spreading the infection. Okay, the reason behind taking oral antibiotics, no, usually they're gonna do IV antibiotics for several months, and the importance of daily aerobic exercises to maintain muscle strength. You want to keep that immobilized. You don't want to spread it out. You don't want to maneuver it. Okay, so let's go to the next question. It says, your patient has been diagnosed with chronic osteomyelitis of the left femur, okay? Your patient has been managing his osteomyelitis at home with IV antibiotics. Okay, that's another IV antibiotics. You come home, and remember, chronic means long-term. You come home, an ongoing process, right? You come visit him at home and come up with the nursing diagnosis of ineffective therapeutic management when you find that the patient A expresses to you that he uses crutches to avoid weight bearing on the affected leg, B takes and records the oral temperature twice a day, C is unable to plantar flex the foot on the affected side, and D is irritable and frustrated with the length of treatment required. All right, so if you guys have been following this study session from the previous questions, we talked about osteomyelitis before. So before you even think of the answer, remember what we said, what was normal and not normal for the patient with osteomyelitis. What is normal for us to do for this patient, right? Remember what in terms of movement, in terms of infection, in terms of this, what is normal? Because what the question is asking you is, as you come to visit him, and that's the thing is, and come up with the nursing diagnosis of ineffective therapeutic regimen. That's just a fancy word. This is a fancy way of saying what will let you know that whatever therapy that the patient's supposed to be on is not working. So what is an adverse effect? What in these answers are telling you, something is wrong here? Because it says ineffective. You have to see the keyword ineffective, meaning it's not effective. It is not working. Therapeutic regimen means what the doctor has ordered, the step by step. What therapeutic measurement is, like what the doctor has ordered. So what would make you say something is not working, something is wrong? Okay, so what would we say? Woo, it's hot. So Web just says C. Okay, Teacher Jen says A. Okay, geoengineering, hi, put a heart. Dana says A. Okay, so which one would it be? Which one do you guys think it would be? Shahar put D. Okay, remember the diagnosis of ineffective therapeutic regimen. That means the therapy that they prescribe for the patient is not working. What do you guys think it may be? Oh my God, it's hot. Hey guys, thank you so much for coming in the building. Don't forget to like the video, subscribe, hit the notification bell so that you never miss a video. If you guys like these videos, press like, press like, press like. All right, guys, I think I'm gonna give 10 seconds, okay? All right, here's the correct answer. Okay, Teacher Jen says C. Okay. So let's see who's right. The answer is indeed C. Good job. The answer is C. The answer is C, is unable to plantar flex the foot on the affected side. Okay, so before I even go to the next slide where I dig deeper into the explanation, remember number A says expresses to you that he uses crutches to avoid weight bearing on the affected leg. Is that a good thing or a bad thing? Is that what we want them to do, or is that what we don't want them to do? I want to see your answers. Because remember, the question is asking you to find out what is wrong. Like what is wrong with it, okay? Like what is showing to you that okay, something that the patient is doing is wrong. It's not working. So expresses, if the patient comes to you and the patient has chronic osteomyelitis and says that, and it tells you that, oh, they use crutches to avoid weight bearing on the leg that has osteomyelitis. Is that right or wrong? Okay, I had a doubt with this one. That's okay. Okay, so remember in the previous slide when we talked about osteomyelitis, how we avoid exercise. Remember in that question, we avoid exercise, and then even in the question before that, we talk about immobilizing of the right leg because weight bearing exercise is considered moving it. And we also talked about how, bone is very vascular, right? So we don't want to put heat in it because we don't want it to spread. Remember, we talked about with osteomyelitis, the main key is we want to keep it immobilized. So he uses crutches so he don't have to weight bear. And imagine if the patient walks on that leg that has osteomyelitis, don't you think that will be extremely painful? It will be. Yeah, not supposed to weight bear. Yeah, that's not part of treatment. Yes. So that's why Teacher Jen says the doctor's treatment plan isn't helping the patient. That's not part. Yeah. So basically, the question is asking you what is showing you that there's something that he's doing that is wrong. So yes, they would use crutches to avoid weight bearing on the affected leg. Oh, okay. Yeah. So basically, what I'm saying is What I'm saying is when you're looking at this question, you have to look at what they're asking you. They're asking you, if you come home to visit, you come visit him at home, right? And you come up with a nursing diagnosis of ineffective therapeutic regimen. So what is ineffective therapeutic regimen? That means something that you see something that is not right. That means either the patient is not following the right thing, or maybe even the doctor's orders. Sometimes the doctor's orders could be off and not right, and you need to report back to the doctor saying, um, hey, whatever you're doing, like this antibiotic is not working for the patient. Maybe we should try a new one, right? Maybe you want to come visit the patient again because this patient is complaining of pain. Can you prescribe something stronger? So we want to see ineffective therapeutic regimen. So this question is automatically asking you what is wrong. So in these answers, you want to see which one is wrong, okay? So if the patient is telling you, express to you that he uses crutches to avoid weight-bearing exercise on unaffected leg, remember from our previous slides, we want him to do that. We want him to use crutches because we don't want him to bear so much weight on the affected leg because we're immobilizing the leg. We're not trying to mess with that leg a lot. We're trying to hopefully cure that infection in that leg. Okay, so the main therapy for it is to immobilize that leg. Okay, let me see what you guys are saying. Once you explained the question, I made better sense of my answer. Okay, yeah. So sometimes the questions, like if you read fast, or sometimes you got to read it like 2 or 3 times to like understand it because it's like kind of written a certain way. And I've had questions that are written a certain way. Okay, Dana says, I was thinking C earlier, but not so sure. That's what happens when you don't go with your gut answer. Aw, happens to me in exams and I hate it. Aw, that's okay. That's okay, Dana. That happened to me several times, okay? That happened to me several times in the past. We know the answer, but it's like we choose the wrong one because we're thinking about another. But the main thing is to understand why it's the right answer, and like, don't lie to yourself. If you don't say to yourself, oh, okay, I understand. No. If you don't understand, you know, when you take the NCLEX, right, or when you are in the nursing school and you sit down on that table or you go on your computer to take that test, remember, if you use a study group or whatever, like nobody's gonna be giving you the answers. That camera's gonna be looking at you if it's online, or there are teachers you can't. That's why I always remembered in my head, and that's what always encouraged me to ask questions in class, even though people got annoyed, because I realized like this person is not going to help me answer the question when I have this exam, and I need to pass this exam in order to pass so I can move forward and I don't have to repay tuition for the other semester. So that's what you have to think. You have to make sure that you really understand why it's right and why it's wrong, and if there is any holes, you have to dig deeper and find out, okay, why I don't understand it. Because best believe something like this can come again. Because, you know, osteomyelitis is like kind of like I don't remember having osteomyelitis on my NCLEX, honestly, but it's kind of like a common thing, you know, that people usually can see in nursing exams or NCLEX because it's like common, you know? So yeah. So that's okay. It's okay. We all do that. Sometimes we go with our gut answer and like, why didn't we choose that? It's okay. It's okay. All right. So why is B right Yes, we want the patient to take and record their oral temperatures twice a day, okay? I didn't even know it was specifically twice a day. I feel like that's a little bit overkill, but yes, we do want them to take and record their oral temperature because, like I said, osteomyes, infection of the bone, we don't want that temperature to rise high because that we don't have to go through why a high temperature is bad. It's bad for so many reasons, okay? And D, is irritable and frustrated with the length of treatment. I feel like, okay, Shahar chose D. I feel like you probably chose D because you didn't understand the question that much, like what it was asking, but it wouldn't be D, is irritable and frustrated with the length of treatment required, because we expect a patient with chronic osteomyelitis to be treated over several months. So if acute, like see the previous question says a patient being discharged for acute osteomyelitis, we already saw the explanation was a patient is usually on IV antibiotics for several months. So they're on IV antibiotics for several months for acute osteomyelitis. Imagine chronic osteomyelitis. Of course, the patient is going to be irritable and frustrated with the length of treatment required. Like to be like, God forbid, oh my God, just to think about it, to be on months and months and months of IV antibiotics, and it just seems like there's no end. Like, that's very depressing. So, of course, they're going to be irritable and frustrated. That doesn't mean that the treatment is ineffective. That sentence, that D, letter D, there's nothing in that statement that says, like, okay, but the treatment's not working. It's just saying the patient's feelings. The patient feels irritable and frustrated. They're mad, but it doesn't mean that, for example, I'm working out, right? I'm working out and I just worked out this morning and I feel tired. I feel like, oh my God, I don't feel like doing this. Does that mean just because I feel tired while I'm working out, I feel frustrated while I'm working out because I feel like I'm not where my stamina is where I'm not where my stamina is not where I like it to be. Does that mean that my workout is ineffective? No, it doesn't mean that it's ineffective. Okay, if I'm frustrated that it's taking me months and months to get those rock solid abs, does that mean that it's ineffective? No. That doesn't mean that my workout is ineffective. It just means I'm irritable and frustrated. So that's just basically what the patient is saying, okay? Okay, so teacher Jen says, are the NCLEX questions similar to these questions? Yes, they are similar to these questions. Yes. Shahar says, yeah, I was thinking ineffective therapeutic coping, not regimen. Oh, okay, yeah, that makes sense. Yeah, so yeah, I like the way you think, Shahar. Keep thinking like that. Let's put that on the screen here. That's a good example. Oh, snapski. Let me show this. This comment is beautiful. I love this comment. You know why I love this comment, and you know why I put this up? I put Shahar's comment up on the screen because this is a perfect example of thinking the right way in order to pass NCLEX and nurse school and stuff like that. Because when you get the question wrong, you don't feel bad about yourself and beat yourself up and say, oh my God, you think, okay, I got this wrong. How could it be right? If the nursing diagnosis was ineffective therapeutic coping, it would be D. Good job, Shahar. You did an excellent job. Keep thinking like that. Keep thinking, okay, but if it was this, I was thinking this. Keep making those connections. I'm telling you guys, when I studied for my NCLEX, okay, and if I'm repeating this several times, it's not because I'm bragging. It's because I know I have some new people watching me every single day coming in, and I knew about it like a few weeks ago. I'm like, oh, new people are coming in, but I passed the questions I passed the NCLEX RN in 75 questions or less. And I passed the LPN in the least amount of questions in the least amount of time too. And I was valedictorian for my RN. And this is the key. This is the key. You're supposed to be, when I got questions wrong, I got excited. I got excited when I got questions wrong because I know that I'm learning something new, number one, and I'm able to make those connections. Okay? Don't get depressed and upset when you get it wrong. Get excited because that means that you are learning something new. Okay? Don't just get it wrong and then move on. You have to make those connections. Okay? So that is 100% correct. That would be Shahar. Great job. that's why I want how you guys want you. That is how I want you guys to think. When you get a question wrong, okay, you know what is wrong, but okay, D, okay, I was thinking ineffective therapeutic coping. Excellent. Because that would be the nursing diagnosis for D. Okay, but would it be ineffective therapeutic regimen? Is unable to plantar flex the foot on the affected side. Now, who can tell me what plantar flex is? Okay, so I'm going to give you guys an example of how I remember what is plantar flex. Okay, so plantar flex is when you think about plantar, I want you guys to remember the word plant, like you're planting your foot down. So plantar would be plant, right? Would be this way. You're planting your foot down. All right, guys, I'm not tall enough or short enough, whatever. Plantar is down. You are planting your foot into the ground. So now, for now on, because you're going to see that word again, plantar. Plantar, think of you're planting your foot to the ground. Okay? Plantar flex the foot. So, yes, Dana, thank you. So, I wanted to guys give you an example. Is unable to plantar flex the foot on the affected side. If a patient is unable to plantar flex the foot on the affected side, plantar meaning planted in the ground down, that means that is foot drop, okay? So I put, so what is foot drop? Foot drop is difficulty lifting the front part of your foot, okay? So they're not able to do that. So this is a sign of an underlying neurological, muscular, or anatomical problem. Okay? So they're actually unable to do that. So foot drop means the foot is not being supported in a neutral position by using a splint. Okay? So remember we said in osteomyelitis is, yes, very good. Dana says dorsiflex. Yeah, you're taking the dorsum of your foot up. Very good. Yes, these are great ways to remember. So foot drop means, so if we see the patient has foot drop, that means the patient is not, the foot is not being supported in a neutral position by using a splint. So this is, let's say this is the foot. Okay. Let's say this is the foot. This is the foot, and it's being supported, like this is the splint, is being supported by the splint. Okay, because remember what we said in osteomyelitis, the foot is immobilized. The foot is not, we have to immobilize it, keep it still. All right, and we said why. Bone is very vascular. Vascular means very bloody. It's very easy for it to have pathological fractures, meaning it could break easily because the bone has an infection in it. That means it could break easily. Okay, so foot drop, the patient has a difficulty lifting the front part of the foot. Okay, and I have the picture here. Thank you. Yes, planting your foot down. Yes, and dorsiflex is like this. Yes. Thank you, just Brandy. Yeah, I'm so happy you guys are understanding these explanations. So you guys never forgot. So foot drop is usually a neurological, muscular, or anatomical problem. Okay, so it's unable to plantar flex the foot on the affected side because there's an issue there. Okay, so see, you have an example of a foot drop. Okay. So let's see the next question. Okay, an 18-year-old patient has a 6-year history of muscular dystrophy, okay, and is hospitalized with a respiratory tract infection. Okay, which nursing action will be included in the plan of care? Okay, is it A, teach the patient about the muscle biopsy procedure? B, assist the patient with active range of motion exercises? C, log roll the patient every 1 to 2 hours? Or D, provide the patient with a pureed diet? Okay, So the first thing that should come to your head is, what is muscular dystrophy? Okay? And the patient has had it for 6 years. What is muscular dystrophy? Okay, we already know what a respiratory tract infection is. It's in the respiratory tract. It's an infection. Pathogens are in the body, okay? Then you're going to want to, this is how I think through it. I want to know, this is how I think through every question. When I'm taking the NCLEX, I think, okay, what is the question asking me? What is muscular dystrophy? What are these vocabulary terms, okay? A, muscle biopsy procedure. B, active range of motion. If you guys don't know what active range of motion is, just what it sounds like. Range of motion is like this. Right now I'm doing active range of motion. Passive range of motion, if somebody takes my arm and does this, that's passive range of motion. Log rolling the patient, taking them in one unit and moving them. Pureed diet, which is D, is like that, you know, that that kind of like soupy kind of food. Not soupy, but you know when the patient can't swallow it, right? That it's basically easy to swallow food. It's like chopped up and blended, and a puree diet. So what do you guys think it is? Shahar says B. Dana says B. Okay. B says, Dana says B because their motion is restricted and you want to help them with that. Okay. Okay. I'm going to give you 10 more seconds now for you guys to guess. Well, not take an educated guess and see what you guys think. Don't forget to like the video, hit subscribe, hit the notification bell so that you never miss a video. Okay, Teacher Jen says B. Okay, so we've got all B's so far. All right, let's see what the right answer is. You guys are right. The answer is B. Assist the patient with active range of motion exercises, okay? So why wouldn't it be A? And I put here, a muscle biopsy is for the actual diagnosis of muscular dystrophy, okay? So muscle dystrophy, they go into the muscle, they take a section out, and then they examine it over a microscope, whatever. So I say, what is muscular dystrophy? Okay, so muscular dystrophy is a generic term. It is a group of inherited diseases that damage and weaken a patient's muscles over time. Okay, they're lacking a protein that is necessary for muscle function which is called dystrophin. Okay, so in this picture, I put a little picture here. This is actually, I'm probably pronouncing it wrong, but Duchenne. It's a disease called Duchenne, and it could be seen in kids. And this is something called Gower'S Sign. And this is one thing I want you guys to know, because when you guys go into pediatrics, 9 times out of 10 you're gonna have to know it. But this is just basically, if you see a child exhibit this symptom, like how they get up from the floor. So if they're on the floor, and there's like a great video on YouTube if you Google Gower's sign, but it's just good to know because you're gonna probably see it in your test or even on the NCLEX. But Gower's sign is basically a sign that the patient, the pediatric patient, may indeed have a muscular dystrophy disease. So usually when you go up from the floor, you just get up, right? But it's not normal for a child to get up like that. You see, from the first picture, you see the child has their hands on the floor, then they have their hands on their knees, and they're using their hands to push on the legs to stand, okay, instead of their legs. So that thigh muscle is obviously like being affected. That's why they're using their hands to get up instead of their legs. Okay, so that's called Gower's sign. So it's good to know that. Okay, so what should we do for this patient? So muscular dystrophy. So it's very sad because there's no treatment. There are treatments, but there's no like cure. But the only thing we can do for a patient with muscular dystrophy is try to keep them as active and independent as long as we possibly can. Okay, so what do? We have range of motion exercises to do with them. We can do stretching exercises. It helps keeps their limbs as flexible as possible, okay? Because when a patient has muscular dystrophy and their muscles are weakening away over time, their body tends to want to draw inward. The body tends to want to draw inward and become like that in the fixed position. So basically like contractures. So if you ever saw that in the nursing home or whatever, it's a very sad thing. That's why we want to keep them having range of motion exercise, keep them stretching so that their muscles don't go in, because that's what their muscles want to do because it's being weakened, okay? Another thing we can do for this patient with muscular dystrophy is we can use braces to support those weakened muscles. Mobility aids such as canes, walkers, and wheelchairs help facilitate independence. And sadly, because we use our muscles to breathe, right? Sometimes if it gets really, really bad, the patient may need to be on a ventilator or actually have a sleep apnea device. Okay, so guys, I hate learning about certain diseases because it's just so sad. But yeah, so that is what we do for muscular dystrophy. Yeah, so there's no reason to provide a puree diet unless like there are some problems with swallowing, which is not given here. Okay, log rolling the patient would be to move them as a unit. So if they are the patient has a history of muscular dystrophy, there's no reason to log roll the patient because log rolling is more so used if there's like if there's something in their spine, like if if the patient has a spinal injury or something and you can't move them a certain way, you have to keep them in a certain way. But there's nothing in the question that indicates that they have to be log rolled. And of course, we're not going to teach the patient about the muscle biopsy procedure because it says right here, it has a history of muscular dystrophy. So we already know they have muscular dystrophy, and muscle biopsy is for diagnosing. So we're not diagnosing, we're saying what are we doing for the patient. So the answer would be B. Okay, so I hope you guys understand that. If you guys have any questions, leave it down below. Okay, if you guys have any thoughts. So I hope that is clear. I think it's clear because most people put B. All right, so let's go to the next question. Okay, let's see how many questions we have left. We got a few more questions. Wow. Okay, so the nurse comes up with a nursing diagnosis of pain related to muscle spasms for a patient with acute low back pain associated with acute lumbosacral strain. Okay, don't let any of these words intimidate you. Okay, an appropriate nursing intervention for this problem is to teach the patient to A, keep the head elevated slightly and flex the knees when resting in bed. B, avoid the use of cold because it will exacerbate the muscle spasms. C, twist gently from side to side to maintain range of motion in the spine. Or D, place a small pillow under the back to flex the lumbar spine gently. What do you guys think it is? As you guys come in, don't forget to hit the like button, subscribe, hit the notification bell. Okay, so what do you guys think the answer is? So the nurse comes up with nurse diagnosis of pain related to muscle spasms for a patient with acute low back pain associated with acute lumbosacral pain. So lumbosacral is basically the lower back. Okay. All right, I'll give the 10-second marker. Okay, Shahar put D. Place a small pillow under the back to flex the lumbar spine gently. Question. Okay, let's see what it is. It's actually A. Keep the head elevated slightly and flex the knees when resting in bed. Okay, so basically I said break it down into simpler terms, okay? What the heck is lumbar sacral pain? So it's just a fancy word for lower back pain, okay? Because the sacrum is like here, lumbar, okay? So an injury that causes lower back pain. I said, what is the causes of lumbar strain? Okay, excessive physical activity, falls, repeated bending and lifting, which puts pressure on the back, poor sitting posture, obesity, and sitting for prolonged periods of time. So all of that can cause lower back pain. Okay? So I said other questions to discover when addressing lower back pain is, well, how are you sleeping and what is proper body alignment? Okay? So I can testify to this is that sometimes I do have lower back pain. I had lower back issues when I was younger. I went for physical therapy and stuff like that. And that's why a lot of people think I did modern dance because of the way my back is curved. But that's just because of the little S I have on my back. But this is basically a good example of how to sleep when you have lower back pain. It's all about making sure that spine is aligned, okay? So, and even here I put a picture of like the different head positions you guys can take a look at. And if you go back to the question, it says, A, keep the head elevated slightly and flex the knees when resting in bed, okay? So you could use cold on muscle spasms, heat and cold. You can use those therapies. So you don't want to necessarily avoid them. You can actually use them, okay? Shahar says, I did not know the correct answer. I guess I'm doing the wrong thing when I come home with a backache. Oh, yes. Trust me, Shahar, I have done you know how many times I've woken up with back pain because those causes, sometimes I do push myself a little bit too much on the gym, excessive physical activity. And when I'm working, I do repeated bending and lifting sometimes. So, and poor sitting posture. But yes, sleep position is very important. And you may think that your back is straight, but it really isn't. Okay, so avoid the use of cold. So we could use heat and cold for muscle spasms. There's nothing wrong with that. Twist gently from side to side to maintain range of motion in the spine. Like twisting can actually aggravate lower back pain. Okay, place a small pillow under the upper back to flex the lumbar spine. No, that just makes it worse. Okay, You're welcome, Shahar. Teacher Jen says A. Yes, it is A. Okay, so that is the answer. Okay, so next question is, your patient with a herniated, okay, that means it moved, intravertebral disc undergoes a laminectomy and a discectomy. Okay, so we're talking about the back. Following the surgery, the nurse should position the patient on the side by, what do you guys think it is? While you guys think of the answer, I'm going to use the restroom for 1 second. Okay, guys. What do you think it is? Having a patient turn by grasping the side rails and pulling the shoulders. B, elevating the head of the bed 30 degrees and having the patient extend the leg while turning to the side. C, turning the patient's head and shoulders and then the hips, keeping the patient centered in bed. D, placing a pillow between the patient leg and turning the entire body as a unit. Okay, so Shahar put D. Okay. All right, so I'm gonna do the 10-second countdown. Okay, so far Shahar is the only one who who gave her answer. Don't forget to hit the like button. All right, so let's see what it is. It's D. Good job, Shahar. Placing a pillow between the patient's leg and turning the entire body as the unit. That is correct, okay? So the patient underwent a laminectomy. So I said, well, what the heck is a laminectomy, okay? So laminectomy, ectomy, meaning remove. Remember the keyword ectomy? And it's actually a surgery that creates space by removing the back part of a vertebra that covers your spinal canal. Okay, so this is basically your back, and into the back, that's your vertebra. So that is the lamina that they are singular lamina. That's the lamina that they are removing. So it's basically the back part of the vertebra that covers the spinal canal. Okay, so they usually do it to like remove pressure if there's any pressure, or if there's a herniated disc, like in this case, in this patient case right here. Okay, so they're removing this. Okay, so I said, so what are you going to do? Okay, what are your nursing interventions when it comes to movement for this patient? Okay, so the main thing you want to do, because it is the spine, you're going to avoid misalignment. Okay, so you're going to instruct the client to avoid spinal flexion or twisting because the spine should be kept aligned. So it's all keeping it aligned in a single unit, okay? So when we are placing a pillow between the patient's leg and turning the entire body as a unit, that is what's happening, okay? We're making sure that we don't twist the body in any way that can affect the spine, because the spine is super sensitive, okay? Minimize sitting I accidentally spelled it nay, which may place a strain on the surgical site. Okay, they may lie supine or have other activity restrictions. You're going to avoid extreme hip flexion when lying on the side. And when the client is in lying supine, you could place a pillow under the neck and slightly flex the knees. Okay, so that is what we want to do. We want to make sure we place the pillow between the patient's leg and turn the entire body as a unit, okay? So that is what we want to do. We want to with this one, when it comes to laminectomy, we want to make sure that the entire body is kept as a unit, okay? So is there any questions with that? Yeah, so we're not going to do C, turning the patient's head and shoulders and then the hips. That is too much twisting and turning, okay? Elevating the head about 30 degrees and the patient extend the legs while turning to the side. No, we want to keep it straight, okay? And I think the key word, if you don't get anything in this one, the key word is teacher Jen, it won't be C, turn the patient's head and shoulders and then the hip, because that's too much turning. It says turn the patient's head, then the shoulders and the hip. That's already twisting it right there. You don't want to twist it. You want to keep it straight. The key word, anytime you see answers and you see the key word turn the entire body as a unit, that means that it's keeping the spine aligned. But that's the key. If you guys don't get anything here, because sometimes actually that's what my brain does. Like, sometimes it's hard for me to look at something and imagine it. Like, what do you mean turn the patient's head? But the simple preposition saying turning the entire body as a unit, I already know that means they're keeping the body straight as a unit. That means it's not one and then the other, because that's what basically C is, right? Turn the head and then the shoulders and then the hips. We got to keep that spine straight, because remember, we remove something from that spine, and we all know the spine has to remain straight, because we all know the spine controls our movement. We got to keep that very straight, aligned, so that it heals properly, okay? That's why they say that if a patient has a spinal injury, like if they jump off a cliff or something and then they accidentally injure their spine, you want to keep that person straight, and they have the flat board and you want to keep them as straight as possible. Sometimes they don't even want to move it. So you could place a pillow between the patient's leg and move it. That's how you do turn them to the side, okay? So you want to turn them to the side without disrupting that alignment, okay? So yeah, guys, so that's why it wouldn't be C, okay? So yeah, you wouldn't have the patient grab sideways and pulling the shoulder. That's still twisting. See, look, my spine is still twisting. Elevating the head about 30 degrees and have the patient extend the legs, turn to the side. That's still twisting. All of them are twisting. But the main takeaway is look at that sentence saying turning the entire body as a unit. That's the key word. Okay? All right. Next question. You are working in the med-surg unit. A patient is reporting numbness and tingling of the right lower leg following a laminectomy, which what we just went over, with a spinal fusion, okay? The first action indicated by the nurse is so remember, laminectomy, we're removing the back part of the vertebra, like the previous question, and spinal fusion, we're fusing the spine. So check the vital signs for indication. What will be the first action that you do if a patient has a laminectomy and they're reporting numbness and tingling of the right lower leg? Would you first check the vital signs for indications of hemorrhage, B, check the chart for preoperative neuromuscular assessment data. C, report the patient's complaint to the surgeon. Or D, turn the patient to the side to relieve pressure on the operative area. What would you guys think? I'm going to let you guys leave your answer down below. Okay. Shahar put A. Remember, they remove something from the spine, okay? They remove something from the spine, from their back, and all of a sudden, they have right lower leg numbness and tingling. They did not, remember the spine, there's nerve tracts that control movements in your body, okay? They remove something in the spine, they mess with the spine, and now they're having numbness and tingling. Numbness means that they're losing feeling in their right lower leg. The surgery wasn't in the leg, the surgery was in the spine. But remember, the spine has spinal tracts that can control different parts of the body. What do you guys think it would be? Nutshell put C, report the patient's complaint to the surgeon. Okay. Ooh. What would the first thing you do? Someone just got back surgery and all of a sudden their right lower leg, they can't feel it. They can't feel it. And it's tingling. What would be the first thing that you do? Think through that. Think through it. Think through it. Think about the nursing process. ADPI. Assessment, diagnosis, intervention, planning, evaluation. Okay, there's Kiki Coconut Cake, say A. All right, I'm gonna do the countdown soon. Okay. Five, four, three, two, one. What is the answer? What is the answer, ladies and gentlemen? Don't forget to like the video, hit subscribe, and hit the notification bell so that you never miss a video. What is the answer? What is the answer? Okay. Then assess. Okay. The answer is B. Okay. The answer is B. The answer is check. Okay. The answer is check the chart for preoperative neuromuscular assessment data. Okay. So, yes, I understand, Miss Nutshell 777, why you would check A. Because ADPI assessment, checking the vital signs is a sign of checking the vital signs is an assessment. But you have to look at the rest of the census. It says check the vital signs for indications of a hemorrhage. So this answer is testing to see do you know what the signs and symptoms of a hemorrhage is? So is there anything in the question that tells you that the patient may have a hemorrhage? Like, okay, yes, you would check the vital signs to make sure, blood pressure is not dropping and pulse is not rising. But you know what? The first thing you would do is check the chart for preoperative neuromuscular assessment data. Now, before I even give the explanation, I'm gonna go back. So when I saw this question, the first thing that popped out to me was check the chart for preoperative neuromuscular assessment data, okay? The first thing I didn't think, I didn't think A, because there's nothing that really showed me that, oh, I should probably check the vital signs real quick. The patient may be hemorrhaging. Because if a patient is hemorrhaging, like 9 times out of 10, they will be out of it, okay? Because think about it. If they're hemorrhaging, they're losing blood, they're going to be like this. They are not going to be fully conscious. Their level of conscious is going to be low. They're not going to be able to talk to you, but the patient is talking to you. The patient is reporting to you, hey, he feels numbness and tingling of the right lower leg. A patient who is hemorrhaging out, is bleeding out, will not be able to report that. You will see it before, 9 times out of 10, you will see it before the patient is reporting. So that's number one, the level of consciousness. The patient is speaking to you, they're able to report it. 9 times out of 10, they're not hemorrhaging. Because remember, hemorrhaging is bleeding out. 9 times out of 10, they are not hemorrhaging, okay? That's just a really coconut. Oh, what are you referring to? That's okay. So nutshell says, so you can see if the numbness was there before surgery. Yes, because the thing is, preoperative means before surgery. So before surgery, okay, you have to ask yourself, why would a doctor even prescribe laminectomy with a spinal fusion? Why would anybody, okay, think of it like this, nutshell. Why would anybody walk up to you? Why would a doctor walk up to you and say, okay, I'm going to give you back surgery? Why would a doctor tell you that? Okay, if you go to the doctor today, will the doctor say, okay, you know what, nutshell, I'm deciding we're going to do a laminectomy. I'm going to remove a part of your vertebra. Why would the doctor prescribe that? Ask yourself, why would the doctor just walk up to you randomly if you went to the doctor today and say, hey, we're going to do a laminectomy on you? Would a doctor just do that out of a blue? No. The doctor would do that based off of assessment. And what's part of assessment is subjective data, which is what you say as the patient, and what the patient says, and objective, meaning tests and stuff like that. So usually laminectomy, it's used to remove pressure, okay, from in the spine. So the patient may have had numbness and tingling before, or they may have not ever had numbness and tingling before. But before we do surgery of the spine, we're going to ask that patient, especially as nurses, hey, and the doctor's going to ask that too, obviously, but you're going to ask, hey, do you feel numbness, tingling? You're going to go through a whole chart. Do you feel it's part of the full assessment? Do you feel numbness and tingling in any part of your body? Yes, no. Do you feel this and that? They're going to get a full picture of the patient before they do any types of surgery. Why do they do that? Because they want to know, because how do you know if something worked? You want to know how it was before, right? It's just like a car. Before you get your car fixed, you want to know how it's before. Is the engine moving? Okay. Let's give an example. I put diesel in my car. I make mistakes, guys. I put diesel in my car. Before they went ahead and found out that diesel was in my car, they had to assess my car first. They ran it through a computer and they found out that for some reason my car couldn't start. I had to call someone in. They had to assess it first. Okay. So after they fixed my car, they found out, okay, her car is running well. Let's compare it to how it was before. So that's the first thing. That is why they doing that assessment. Okay. So Shahar says, okay, so basically we are going to check first to see if it is a change in their baseline condition. That is 100% correct. Yes. Okay. So that's what we're going to do. We are going to check first to see if there was a change in the baseline condition. Yes, and if there is a change, if there was no numbness and tingling before, you're going to want to report that to the surgeon right away, ASAP. Because remember, guys, I don't know if you guys watch these YouTubers, Cole and Charisma, and I love their channel. They're these two interabled couple. I think that's the right way to say it. He had an accident where he jumped off a cliff and he basically injured his spine. You know, your spine controls your body movement, okay? And the higher the higher a patient injured their spine, the more paralyzed they will be, right? So whenever you mess with the spine, whether it's an epidural from childbirth or surgery like laminectomy, removing a part of the vertebra, whenever you manipulate the spine, of course, we're going to watch for infection, but we're going to watch to make sure that the nerves are functioning correctly. That's number one key, okay? Because if the patient had a laminectomy, something removed from their back, and all of a sudden they're reporting numbness and tingling of their right foot, that means something is wrong. Maybe there's a nerve that got pinched. Maybe the body is not responding well to the spinal fusion. It could be a number of things because you're messing with the back. And the back, remember, has nerves tracked all over. It controls your whole body movement, okay? Because there's all types of nerves throughout your back. That's why they say, like, you know, you got to be careful when you're diving off a cliff or you're doing something, because you don't want to injure your back, okay? So yeah, Shahar, you watched them? Yeah, they are a beautiful couple. They are. Oh, Nurse Kiki Coconut Cakes. Hey. She put okay, Shahar says got it. She put an owl. Oh, that's so cute. You guys are so adorable. Oh my God. But yeah, so that's basically why. So yeah, so I said, so that's why the first thing you would do is check the chart and look to see if it's the same. If it's the same, if the patient reported the same amount of numbness and tingling, then you don't really have to report it right away to the surgeon, because if the patient experienced it before, maybe the spine has to heal a little bit more before we see the results of the laminectomy. Maybe we have to wait to see, maybe you have to wait to see, okay, the doctor performed the laminectomy. Maybe we have to wait a little while for it to properly heal. Then they won't have that numbness and tingling, okay? But if it's worse, or if the patient didn't have it before, if they never had numbness and tingling before, and right after surgery they have numbness and tingling, that is a major red flag. You have to report that right away to the surgeon so the patient doesn't get paralyzed or anything. That the surgeon has to look, make sure there's no pressure, make sure there's no infection, because you do not want to mess with that back, okay? So you're not going to turn the patient to the side to relieve pressure on the operative area, because the operative area is in the back and the problem is in the leg. We're not going to check the vital signs for indications of hemorrhage, because, like I said, if the patient is hemorrhaging out, their level of consciousness, they're not going to be able to report numbness and tingling. They are going to be out of it if they're bleeding out, which is basically what hemorrhage is. So yes, we're going to want to do B. We're going to assess, and that's a way of assessment, ADPI. We're going to assess the data, and we're going to see, hey, did they have that before? Did they have that after? And if they didn't have that before, report that. Report that right away, because the patient could become paralyzed or there could be something seriously wrong, okay? All right. So that's why I said movement and sensation should be unchanged or improved following the surgery, okay? If it gets worse, report it to the surgeon, okay? Turning the patient will help. It's most likely a nerve issue. Get help now, okay? If it was worse, okay? So, next question. Let me see. Wow, we're already on 2 hours, guys. Oh my gosh. Let's see how many questions we have left. Okay, this is actually the last question, guys. This is the last question. All right, guys, last question. Thank you guys so much for sticking with me throughout this entire, for those guys who have from the beginning to end, for those who came in the middle, for those guys going to watch this video after it has posted. Thank you so much for being there and supporting my channel. Thank you guys for liking the video, subscribing, and hit the notification bell. I really appreciate it. It really helps my video. And yes, so let's see the last question. It says, which of the following assessment finding is indicative of the presence of osteoporosis in a middle-aged patient? Is it A, an aversion to dairy products? The B, the presence of bowed legs? C, statements about frequent falls? Or D, measurable loss of height? What do you guys think it is? Don't forget to hit the like button. What do you guys think it is? I'm gonna let you guys give an answer. Okay, Shahar says D, measurable loss of height. Nutshell 777 says D, measurable loss of height. Okay. Okay, I'm gonna do the countdown. Oh, thank you, Shahar. Thank you for the $5. Thank you. Mwah, mwah, mwah. Thank you. Okay, we're gonna give the answer. Drum roll, please. It's D, measurable loss of height. Okay, so I wanted to quickly say why it wasn't B. It's not the presence of bowed legs, because the presence of bowed legs is actually a symptom of osteomalacia. Okay, and what is osteomalacia? Osteomalacia is softening of the bones from severe vitamin D deficiency. Okay, so when you see the picture, yes, Nurse Kiki Coconuts, that's correct. It's D. So when you see the picture, you see the first set of legs. That's a normal alignment. Okay, sometimes you can see that in children who are growing up. This is bowed legs. Is the second picture. See how the legs are like kind of like almost like a diamond. So that could be a symptom of osteomalacia, which is a softening of the bones from severe vitamin D deficiency. And then the last one is like knock knee. So that's why it's not going to be the presence of bound bones. Okay, so we're going to see a measurable loss of height. Okay, so I put, what exactly is osteoporosis? I'm sure everybody has heard of osteoporosis in a commercial or something. So it is actually bone demineralization. Okay, when the bone becomes demineralized with loss of calcium and phosphorus, which makes up bone, and that leads to weak, fragile bones and risk of fractures. Okay, and that happens frequently in the wrist, hip, and vertebral column. So as you guys see that vertebra, you see the bone. So the first picture on top, you see normal bone, and then the one on the bottom, you see all those pieces missing. See how full the first picture was, but then the one in the bottom is the loss of calcium and phosphorus salt. So all that calcium and phosphorus is out, so it makes the bones very weak and fragile. So that's basically what osteoporosis is. Okay, so that could happen over time for an adult. It could happen because of extreme lack of calcium. Okay, and you could prevent that by participating in weight bearing exercises, eating the proper amount of calcium. Okay, so what would you see in a patient with, oh, hey, Dacha, what would you see in a patient with osteoporosis? You will see problems with balance, okay? Back pain after lifting, bending. Oh, Teacher Jen says D. Yes, you were right. D, Teacher Jen, yes. You will see a decline in height from vertebral compression, kyphosis, and you will also see the patient will also be at risk for pathological fractures. I think that picture where it shows normal bone and it shows osteoporosis bone with all those holes, all those missing pieces, I think that's a great example. But yes, that's why some people, some older people, yes, older, some people as they get older, they can have a decline in height if they get osteoporosis. So that's why it's very important, guys, like to, no matter how old you are, to make sure you exercise. If you hate the gym, participate in a sport. I started golfing. I started tennis. I'm about to start swimming soon. I just have to find a proper swim cap and I'm good. And make sure that you increase your calcium, especially for women over the age of 30. Yeah, gotta increase that calcium. Gotta make sure that we're getting that calcium, right? Because it's very serious. And yes, that is a symptom of it. Okay, so yes. So it's not going to be the, I thought it was, I was like, why not presence of bowed legs? But that's actually a sign of osteomalacia, which is softening of the bones. Okay. So that would be the assessment of the symptom. Okay. Frequent falls can be a result of it. Okay. But it's not indicative of osteoporosis. Frequent falls could be any reason, but it's not really indicative. But measurable loss of height, yes. So you guys got that on the money. Got that on the money. All right, guys. So this is the end of the slideshow. I want to thank you guys so much for participating. Yes, loss of height. I want to thank you guys so much for participating. I'll make sure that I get my calcium and my exercise because I'm already 5'2". I don't want to get any shorter. Well, there's nothing wrong with being shorter, but I want to keep my height, you know? So, yeah, thank you guys so much for watching the video, for participating in this live. I really appreciate it. And I want to let you guys know that, oh, don't forget to like the video, subscribe, hit the notification bell. I want to let you guys know that because I have a new job starting, and I will make a separate like day in the life video of that new job. I have a new job starting next Sunday. There will not be a live next Sunday, but there will be a live the following Sunday and the following Sunday after that. But I just want to let you guys know in advance. I'm going to try to sneak a live in this week or a video. So stay tuned for that. But just next Sunday, they won't be alive, but the following Sunday after that, there will be a live. Okay, so thank you guys so much for studying with me. Yes, Shahar, thank you. Enjoy the rest of your weekend, guys. Bye, Nutshell. Oh, that emoji is so cute. I'm like so obsessed with emojis. But I hope you guys enjoy the rest of your weekend. I hope you guys have a great, blessed weekend. Start your weekend. Have a good day, Nutshell. Yes, start your day, start your weekend great. And you know, just a word of advice, like stuff I'm learning is that to be patient. I guess that's what I'm learning like this week is to be patient with yourself, patient with your growth. And know that, you know, just do a little bit every day goes a long way. Okay. Whether you're memorizing a lab value this day or you're going over signs and symptoms of diabetes or whatever, a little bit, even if it's 3 questions a day, 4 questions a day, guys, I'm telling you, a little bit goes a long way. With studying, it's not about quantity, like, oh, let me do 100 questions or a million questions. Like, a quantity does matter, but it's more about the quality of studying you're doing, knowing why you're choosing something versus why another, okay? Thank you, Nacha. Yes, thank you. I will let you guys know more about that. So don't worry, guys. I'm not going to just make this channel a study channel and that's it. I'm going to let you guys know more about what's going on, you know, with my life and, you know, me being 6 months as an RN, and I'm going to come out with other videos, other lifestyle videos for you guys. But I really appreciate you guys. Don't forget to hit the like button again. Hit the subscribe, hit the notification bell. And if you guys have anything else, don't forget to leave in the comments down below after this live. This video will be up, and I'm going to be working on my course for you guys. It's going to be Med-Surg. I'm still working on it. It's a lot of work. It's going to have questions. It's going to have videos. You guys going to have it all, and I can't wait to, I'm just, I want to make sure I put out quality, because if it's going to have my name on it, it's going to be quality and something that I would have want before I started nursing school. That is what I'm going to be coming out with, okay? So good luck on your nursing school, where your journey, whether you're about to get in, prerequisites, about to graduate. Good luck. You guys can make it. Trust it. Trust me. I was going through a lot during nursing school, and I graduated on top, but I was going through a lot. And I think I'm going to make a video of like a montage of things I went through, because I did record certain stuff. But I think I'm gonna do that. But just let you guys know, I'm not a perfect person. I had a lot of hours of studying, a lot of hours in the library, 8 a.m. to 8 p.m., a lot of no life, and a lot of no life situations. But I had no life so I could have a life today. And like I said, my life is not perfect, but me being an RN today, it has awarded me a lot of independence, a lot of autonomy, and a lot of choices. Even though I didn't like the job I had before, I was able to switch it up and create a schedule that I like, and I haven't figured everything out, but I could say that I do not regret, because I'm able to help you guys, and I'm able to make a living, and my job as RN is always secure, and and I could help you guys share my knowledge. So that's why I want to make the course and get all my knowledge out before I forget it again, because that's what happens if you don't use it, okay? So thank you guys so much for watching. Don't forget to work out. Don't forget to drink your water, eat your fruits, take care of yourself, pamper yourself today, give yourself a facial, save your money. Thank you, Teacher Jen. Thank you, Teacher Jen. Thank you guys. You're so sweet. That really encourages me. Thank you. And I love your picture, by the way. Your profile. That is nice. Yeah, guys. And yeah, so some of the videos I'm going to be coming out with soon are Day in the Life of RN. It's really going to be Week in the Life. That's going to be coming up. How I preserve my hair, how I wrap it, Thank you, Teacher Jen. Thank you. So, yeah, how I wrap it. I'm going to be coming out with that. Nisha says yes. And I know you guys wanted to see how to give nursing report. That's going to be a separate live. I remember someone requested that last week. What else am I planning on doing? How to juggle multiple subjects at one time, because y'all know I took my nursing prerequisites. Not all of them, but I took my nursing prerequisites while I was in RN school. And while I don't recommend it, I understand some people just want to get school out the way, because honestly, if I waited till I finished nothing wrong with that, all my prerequisites before I started nursing school, I would have just now probably started the program or just applied. But because I did everything at once, I'm able to say I'm RN now, right? So, Shahar says, looking forward to the hair wrapping videos and reporting tips. Okay, yay. Yeah, and y'all gonna see Week in the Life of RN. So y'all see my week, how I do things, and yeah, I just can't wait to share with you guys all of my new videos. And if you guys are interested, if you guys didn't see the video before, I do have a video out that's like before this one. It's basically about the Uber of nursing. So there's this app. It's for CNAs, medication aides, and nurses. And even if you're not a nurse, if you're something else, you could look it up. but you could work when you want, whenever you want. You just go into the app and you work when you want, and you get paid like the very next day. But go into my video to find out more about that if you guys like to be independent contractor. Let's just yes, the nursing report would be great. Okay, so how to give off a nursing handoff report. Okay, I definitely will be doing that. What's happening to my hair? Okay, so yeah, so that will probably be a live or a regular video. We'll see. But yeah, guys, thank you guys so much for watching, and I'll see you guys later. Bye. Have a blessed week.